Good morning, everyone. I have a preliminary announcement to make. An advisory from the Massachusetts Department of Public Health has been issued for all non-vaccinated and fully vaccinated people to wear a mask in public indoor settings in areas of substantial or high transmission. Shrewsbury, Worcester County, has been categorized as a high level of community transmission for over a month. Therefore, we require that all employees and visitors in all municipal buildings wear a face mask. Exemptions from the mask requirement include those with a medical or other eligible condition. In addition, we ask all those attending the meeting to practice social distancing, leave space between yourself and other non-related parties also attending the meeting. The board members here this morning will also be masked and practicing social distancing through their seating arrangements. When speaking, we do ask that your face mask remains on. Thank you. So the meeting is now called to order. And the first item is the review and approval of minutes from the September 17th, 2021 Board of Health meeting. Do I have a motion to approve?
So moved.
I second.
Okay, all in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The next item is review and approval of minutes from the October 5th, 2021 Special Board of Health meeting. Do I have a motion to approve?
So moved.
I'll second.
Okay, thank you. All in favor signify by saying aye. Dr. Abraham?
Aye.
Jenny Fishman?
Aye.
Myself, aye. The meeting minutes are approved. The next item is to review and discuss coronavirus COVID-19 update. And is Karen on the phone? Karen Clark?
Good morning.
Morning.
Good morning.
It's Karen. How are you?
Good, how are you?
Good, thanks. Just wanted to say that I just walked out to a flat tire, so I'm waiting for AAA, so I apologize if I have to jump off it.
Oh, that's unfortunate.
So Karen, do you have any new information? Can you hear us, Karen?
Yes, sorry, I can now.
Okay, very good. Do you have any updates on the coronavirus, COVID-19?
Just what I've been seeing with everyone else on the news that are, continuing to look at booster shots with all of the vaccines. Pfizer, the Fed is available already. Folks can get that by finding it on the VaxFinder website, which I know Carrie has shared, and also on the website. There's almost 500 different pharmacies, different locations that folks can avail themselves of Pfizer booster right now if they are eligible. And there also is a lot of conversation going at the federal level, various approval processes for sort of mixing the so in other words, if you receive 2 doses of Moderna, you might be able to get Pfizer as booster if you're eligible. So there's just a lot of that conversation coming out, and we need to just make sure that whatever is decided, that we're communicating it clearly to the public, because it's kind of overall, just in terms of COVID, we're still seeing community spread and some cluster activity amongst families. We sent the case counts to Shrewsbury from the Maven extract that we do daily. So we just continue to monitor. Obviously, we continue to promote wearing masks, washing hands, social distancing, and there's been, kind of some conversations in Worcester and West Boylston and Shrewsbury that are the alliance towns that have passed the mask mandate about sort of metrics and, you know, when that would be lifted. And in talking with Dr. Michael Hirsch, who is our medical director, you know, we really need to watch the numbers. It's not really just about what's going on in Shrewsbury. It's really looking at Worcester County and the rates. And essentially, according to CDC, Worcester County is still in the red. Not the purple, which is the highest, but is red. And we're really sort of looking at, you know, the colder weather, people indoors. And I know Dr. Hirsch really wants to see what's going on around December 13th, which would be about 2 weeks after the Thanksgiving holiday, to really see what the numbers are. But our hope is that if we continue to press on with vaccination and, you know, through the mask order and just trying to, everybody doing their part, that hopefully we'll be able to rescind mask mandates as soon as possible.
So the metrics that you're looking at, is it basically case counts per week and hospitalizations? And how about vaccination rate? Does that enter into any decision-making, or?
So the vaccination rate, we have that data on Friday. So as soon as I get that from our epidemiologist, I'll be sending that over and we can take a look at it. But Shrewsbury is doing well. But unfortunately, you know, there are still folks, you know, including our young people, that need to get vaccinated. There is breakthrough cases, not that they're substantial, but enough to cause havoc. So when we get the vaccination rate data today for Shrewsbury, we'll certainly send that along.
Okay, thank you, Karen. Dr. Abraham, you have a comment?
Just to add to Karen's excellent summary, the vaccines, both Moderna and Johnson & Johnson, were approved for boosters yesterday. So the CDC approved that advisory panel, and they also allow a mix and match, especially for Johnson & Johnson vaccine recipients. The receipt of a booster with either Pfizer or Moderna has created excellent response rates, as we've known. And the mixing and matching has been there in a number of countries, including Canada. And so we were just waiting for some data. So that's also approved as well. So patients can basically, or people can basically choose what vaccine they get for a booster. The recommendation is still, the CDC didn't come out with any specific advice. They left it to people and their physicians to make that decision. And the FDA has encouraged people to stay with the same vaccine for booster, but if they chose to get an alternate booster, they could. So all boosters are approved. And to the prevalence rates, vaccination rates don't figure into that because people who are vaccinated could potentially still be infected because of breakthroughs. So it's really the case counts, prevalence. So to your specific question, and I think 2 weeks after Thanksgiving, by then, hopefully, optimistically, the 5-year-olds and up will also be eligible for vaccine. In fact, vaccine is already shipped out into the state to be distributed. So we're hoping that'll add on as well. So that should definitely help improve our vaccination rates, hopefully keep our case counts low.
And what is the current state of the hospitalizations in Worcester? I know that was a problem earlier.
Yeah, they've come down. The number of hospitalizations have come down, both at UMass and at St. Vincent Hospital. And about 70% to 90% of the people who are in hospital are unfortunately still unvaccinated. Very small numbers of people who are vaccination breakthroughs in hospital.
Okay, thank you, Dr. Abraham. Any other questions from the board for Karen?
I know, I think last week, the transmission rate was at 2.4%. Do we have an update on what it currently is?
It's still hovering around between 2 and 2.2%, and the vaccine breakthrough rate is only 0.87%, so less than 1% still statewide.
Thank you.
Okay, if there are no other questions in that regard, we'll move on to the next item, which is review and act on the report from the Central Massachusetts Regional Public Health Alliance. And I think we all have the environmental health data from Micah. Anything of particular note, Micah? Or?
The particular, I would just say we've already had 20 complaints related to masks. They're mainly at big stores, grocery stores, things like that, where a lot of people are coming in. But it's partly that it's town to town. People are still unaware that Shrewsbury has a mandate, so I've just been out trying to spread as many masks and copies of the mandate as possible, just to make sure people are aware. And now it's mask wearing has definitely gone up since it's been put in place. So now it's kind of down to just people who are less likely to wear one, and they tend to be a little bit combative or belligerent now. So that's just the complaints we're starting to deal with now.
Okay.
Other than that, we've had just one foodborne illness complaint we looked into, and other than that, we've done about 60 food inspections for the last month.
Okay. Very
That's
good.
all I
thank you.
have.
Any questions from the board? From Micah?
Nope.
No? Okay, I guess unless there's anything else that a board member would like to address, let's review our meeting schedule, which is the next item on the agenda. Now we're getting into November and around Thanksgiving time, so I guess we have options like Friday, November 19th. Should probably avoid Thanksgiving weekend, so
Yeah.
Either that or December 3rd.
19th is fine with me if Jenny
19th?
is.
Yep, 19th works.
19th, okay?
Mhm.
Okay, so let's plan on 8 o'clock, November 19th for the next meeting?
Sounds good.
Absolutely.
Okay. In that case, if there's nothing else, do I have a motion to adjourn?
So moved.
I'll second.
Okay, Dr. Abraham,
Aye.
Jenny Fishman,
Aye.
myself, aye. So the meeting is now adjourned. Thank you, everyone.
Thank you.